want to lie down? You ready, Bonnie?
This woman is not in a doctor's office. She's in a corporate office. Outside this treatment room is the corporate headquarters of Eleme Medical, a startup company in New Hampshire that's launching a new laser device that treats the female affliction known as cellulite.
For her troubled area is her posterior lateral thigh, also called the saddlebag area.
I've always been very self-conscious in a bathing suit, would never wear a bathing suit without a skirt. For somebody that isn't overweight, people would look at me and kind of laugh and say, you can't have cellulite, but I do have cellulite.
And so do 85% of women, according to Eleme's CEO, Nancy Briefs, who showed me around the office.
We designed our facility here to kind of have a relaxing spa-like feeling because our technology, when we launch next quarter, is used in medical spas by derms and plastics. So we wanted an environment for our team members that kind of felt like the environment our products would be used.
An 8-week Smooth Shapes treatment will cost between $2,400 and $3,400. That's the sweet spot of aesthetic spending for women, she says. But to be successful with a device that appears to just vacuum away cellulite and costs $80,000 per unit, Eleme will need more than a feel-good patient experience. Hence, the MIT-trained laser scientist on staff.
I'm not trying to fake science. I am applying real science. Interaction of light and laser with the tissue, it is a big science.
Just weeks away from their product launch date, we found the company's executives gathered around photos of dimpled backsides as a consulting dermatologist tutored them in the subtleties of cellulite chiaroscuro.
I think the difference is quite visible. So if you look at this shadow here, it's a lot narrow on this side here too.
So it's almost like there's a little bit of a lift.
That's right. And if you look at this angle here, this angle is a lot better.
If Eleme gets it right and can change what a woman sees when she looks over her shoulder into the bathroom mirror, then they're in for a big payoff.
I think the reason that there's been so much interest from investors is that the aesthetic medicine practice is growing so dramatically. But also it's a private pay. We don't have to get insurance reimbursement because it's not, as we said, a life-threatening or life-sustaining technology. So there's a lot of interest for patients, and they pay out of pocket.
Up until now, Eleme has mostly been beta testing on friends and family. But starting next month, in April, the FDA-approved Smooth Shapes device will begin arriving at doctors' offices around the country, and Eleme's technology will have to prove itself, not only as a medical solution, but as a moneymaker for doctors.